So I thought I'd try and give you a little bit of practical information of what's been studied on diet in terms of prevention and helpful data on treatment of cardiovascular disease with diet, because people do have questions about what they can do in terms of their diet. And there's a lot of fad diets out there that can lead to improvement in some of the risk factors, but we don't really know if they're going to have long-term benefit in terms of cardiovascular risk. So what are we trying doing with a diet? What are we trying to do? We're trying to target lowering blood pressure, lowering lipids, and then we're also trying to get health benefits through unknown mechanisms that we don't understand necessarily, but have associations with improvement in cardiac outcomes. So I think the strongest data actually comes for the Mediterranean diet. There was a large trial done in Spain of more than 7,000 patients, and it compared what had previously been done as a standard diet for cardiac patients or patients at high risk, and these were patients that were considered high risk for cardiovascular events, meaning heart attack and stroke. And they were compared a Mediterranean diet to a low-fat diet. And that Mediterranean diet was then further subdivided into people that received mixed nuts as a primary fat supplement, and other people that received olive oil as a primary fat supplement. And actually this trial was stopped early because of an added benefit, and where they saw that the Mediterranean diet lowered the risk of stroke and heart attack by 30% when they stopped it at less than 5 years. And so what were the elements that were encouraged in this diet? And this had a pretty careful follow-up with nutritionists that made sure that people were complying to it and were following the details. So they were actually, this trial, not too surprisingly, was sponsored by it wasn't necessarily sponsored, but it was given free nuts from several nut companies and free olive oil from an olive oil company. But it was run by the Spanish equivalent of the National Institutes of Health, and so they didn't have any influence on the trial design or evaluation. But they were given greater than 4 tablespoons of unrefined olive oil per day in the people that were getting the olive oil. And the importance of that, it's rich in monounsaturated fats and polyphenols, which have an antioxidant effect to decrease cardiovascular events. And the nuts, in this case, were walnuts, almonds, and hazelnuts, 30 grams per day that people were encouraged to consume. Pistachios have also been studied in other trials and shown to have benefit. And these are rich in polyunsaturated fats, the different types. These are the various types of healthy fats. And they were encouraged to have greater than 3 servings of fatty fish per week. And fresh fruits and vegetables were supposed to be plentiful, greater than 5 per day. The other components that they were encouraged to consume were legumes, greater than 3 servings per week. Replace all that dark meat with white meat, and have wine about a glass per day was encouraged of most people. If they weren't habitual drinkers, they didn't encourage them to start drinking. And then there was a pretty traditional Spanish component of tomatoes, onion, and garlic that are sauteed together for a sauce that was another integral part of this. And they were discouraged from consuming sodas, anything commercially baked, particularly sweets, pastries, crackers, things like that, red meats and processed meats, so ham, sausage, etc., and then spreads like margarine. They found that that risk benefit of 30% lowering, and people had really good adherence to it, and they did not see a significant weight gain, even though those people eating these items, they were not calorically restricted. So they did consume more calories than in the low-fat diet, but it did not lead to changes in their cardiovascular risk, and actually was beneficial. And then switching the gears towards hypertension, the DASH diet is another form of a diet to follow that has been shown to be successful in lowering blood pressure. You can lower systolic blood pressure on an average of 11 millimeters of mercury, which is not a huge number, but added on to other things, it can make a big difference. And this is particularly helpful in patients that are hypertensive. So it's very rich in fruits and vegetables, 8 to 10 servings per day, whole grain, 6 to 8 servings per day, and low-fat dairy, low on the meat and protein content, high potassium and low sodium, and that combination appears to be very successful at lowering blood pressure. Other interventions, there's many different small trials that have been tried for different things, but these are some of the more interesting ones. They've looked at dark chocolate and compared it to both white chocolate and milk chocolate, and consuming I think it was about 30 grams of dark chocolate per day can lower your LDL by about 5 to 10 millimeters of mercury, and also lowers blood pressure by about 5 millimeters of mercury. Interestingly, chocolate also has in it saturated fats, which are typically a no-no, but these do overall have this benefit. And there was a study sponsored by an avocado company that gave an avocado a day to the people included in the study, and ended up with lowering LDL by 14 milligrams per deciliter. So in general, I think that focusing diet on areas that have data in the areas that we mentioned really can lead to measurable health benefits and lowering your cardiovascular risk. And really the important thing is, if you're eating a chocolate croissant every day, it doesn't help to wash that down with an avocado. But if you actually replace the foods that are not so good for you with these other items that are still healthy and taste good, you can really see the benefits. So that going back to that, gaining weight isn't going to help you. So if you replace some of these other foods, replace your foods that are not so good for you with these other healthier options, even though they might be high in fat, if they're high in healthy fats, overall you can get quite benefit. And, as with most things, more is not necessarily better. So, thank you.